Welcome to Nursing Stories from the Heart. My name is Beth Matarasso and I'm joined by my friend and nursing colleague, Cheryl Burns. Together we acknowledge the traditional owners of the lands and waters from which we're speaking, the Turrbal and the Yuggera peoples, and we offer our respects to their elders past and present. As you listen to Nursing Stories from the Heart, we hope you'll be inspired to tell your stories too, because we know you have them. Cheryl, you'll be reading to us from your memoirs, Memoirs of a Matron. But before we do that, perhaps you could share some background as to why we're sitting here together and why are we talking about telling stories today.
Okay, thanks very much, Beth. In 2020, I retired from my wonderful career of nursing. And I felt as though my curiosity and my creativity, which I'm very renowned for, actually got the better of me. And I sort of started jotting a few points down. Thought, I think I might write a book, give something back to the profession. And through that book, sort of morphed nursing stories. And I went, this is what it's all about. In my book, Memoirs of a Matron, I've included nursing stories. And I'd like to just start by reading some of my book at the moment. Is that okay?
Sounds great.
Okay. So this book is dedicated to all of my colleagues within the healthcare system with whom I've worked for over 40 years. I must also recognise all past, present and future nurses and midwives across the entire world. There are so many and there's so many stories that we can share with this amazing profession. I've witnessed and been intimately involved in so many remarkable activities, observations, situations, and in my career as a nurse, which I've found exceptionally humbling. The human being, human behaviour, and human spirit are remarkable. I had the honour to be involved in these, and sometimes minute by minute, hour by hour, day by day, and year by year basis. I was very privileged. I had an amazing relationship with nursing, and it enabled me to grow so many ways within the profession, within the community and personally. As I used to say to the staff, nurses can do anything, and the nursing profession is an amazing career. I used to say to them, you can rule the world if you want to.
Can I just ask you something? Because when I first read your book, this stood out to me as you talked about your relationship with nursing, and I know that you are one of those people who from a very early age said that's what you wanted to do. So it's very much in your heart. What is that relationship with nursing? How is that relationship with nursing?
Well, it actually allows me to interact with people, which I love. It allows me to care for people, which I love. Mm-hmm. It allows me to, I think the collegiality that I found within nursing was amazing, and I love interacting with people. And I think that communication is an amazing thing as well, which we all communicate. So it allowed me to do all those things. It allowed me to grow, and also it allowed me to become a leader in nursing, which in my early days I was always thought, so people used to say to me when I was a child, you should be a matron, which was quite funny actually. And my family used to call me matron because I'd sort of tell them what to do.
You were bossy.
I wasn't really bossy, but I sort of tried to organise them, etc. Yeah. So the relationship with nursing I found a very intimate thing. As I said, it was sort of my DNA. Yeah. Actually. Yeah. It was my DNA to be able to care for people. And I used to always, as a child, I'd say to Mum and Dad, I think I want to care for all the Aboriginals, I want to care for all the Indians, or I want to care for all the poor people in the world when I was a child. And then that was in the 1950s. So in those days, we didn't know much about the world. And, but nursing has certainly opened my eyes to so many things, Beth.
When you talk about the intimacy of nursing, and that's something that resonates very strongly with me because I think it is a very intimate art. We are, as nurses, invited or we're permitted to be in spaces with people in their lives during incredible vulnerability, and that has always felt very sacred to me. How have you navigated talking about intimacy? Because I know that for a lot of people and a lot of nurses, when we talk about intimacy, they back off a bit. They want to talk about boundaries. They want to talk about a whole lot of stuff that this is not somewhere to go. And yet, to me, and I think to you, it is a hand-in-hand thing. You can't be in that space alongside another human being and it not be an intimate act. And stories must and will flow out of that. So what do you say to people who might shy away from calling nursing an intimate thing to do and be with another human being?
The privilege of being able to care for a person when they're in such a vulnerable situation is something that, unless you've been in it, you really wouldn't know how to explain it, but nurses know that. I think that in my stories that I've written through my book, I've actually tried to bring out some of that intimacy. Some of that. I've got one of our stories, which we'll get into one of our in our podcast, our future podcast, is about hope. So to me, having that intimacy with another human being about supporting them through their illness, providing hope for them, that's actually a very important element of our practice. That intimacy is something unique. And actually, really, when you think about it, other professions don't have it.
No, I agree. For myself, as a person who has been or felt very privileged from early in my nursing work to have the opportunity to participate in clinical supervision, where I had the humbling experience of hearing nurses wiser and more experienced than myself talk about the intimate things of nursing, and it was incredibly vulnerable of them, I thought. But as a person new to nursing, I soaked up those stories, and to this day I don't forget many of those stories because they touched me very deeply as a human being, and they also informed how I wanted to be a nurse and how I made a decision and kept making choices to be that nurse who wouldn't pull back but that would step in.
I talk about, and I've written about, being a student, and I was hospital-based trained, but the tutors we had, they shared their wisdom so much with us. It was amazing, and that's never left me. And I'm sure even today, the facilitators are sharing their wisdom with the students that are coming in through the university. I think that wisdom must continue. We must continue. I learned throughout my long profession, I learned something every day of my life. And I was really, really wanted to learn, wanted to be able to learn more about this amazing thing of nursing. Do you know what I mean?
Yeah. You spoke about the curiosity right off the bat when we started. And I think
the creativity.
Yeah.
And I've been renowned to be a little bit too creative sometimes and maybe get into trouble, but anyhow.
Well, if you think about the complexity of a human life for all of us, and how can we not be curious about that? How can it not be complex, and how can it not call on us to be creative in the manner that we might work alongside people, their families, whoever and whatever is important to them. So it's an incredible strength.
An amazing strength. And I think that through nursing stories, we can really strengthen the profession, I believe, or strengthen our practice through sharing nursing stories and things like empathy. Empathy is such an important part of nursing, and that intimate part you're talking about, that part of understanding that other human being, understanding how they're feeling, putting yourself in their shoes, in the situation they're in. Always, whenever I was with a patient, I'd always put myself in their shoes and always visualise what was happening with their body.
I remember reading that, and I was very it intrigued me because I think I've shared a similar experience with you as a student nurse, learning to take blood pressure on a sphygmo, and how I would close my eyes and I would visualise the parts of the body and what might be happening when you're occluding and, putting the pump up, and that really spoke to me.
Yeah, exactly. The other thing is about our values in nursing, our values of integrity, our values of, social justice, our values of autonomy and privacy, making sure all those things, all those unique things occur when we're caring for people. Our values are so important to me. Throughout my whole career, even as a leader, the values were the key part of the framework I worked on. I think the other thing is about our stories also. Every single person that we've cared for has a story. And I used to say to the staff, take the time, listen to the story of the person, because that'll help you with your nursing assessment, your nursing care planning, and, help them throughout the journey that we have them under our stewardship, which is only a short time really when you think about it, until, they're discharged and then home in their own environment or wherever they're going, whatever the outcome is.
This has just occurred to me, and it's how my brain works. The 3 C's. So you talked about career, you talked about curiosity, and you're talking about values. And in my experience, people talk a lot about values. I mean, I've talked a lot about that too, but values have to live and breathe in us. They have to be brought to life. And I think that you have been a very courageous nurse right off. I mean, I've read your stories from when you're a student. Courage is a bit of a hallmark for you. And I think that to have that true harmony between your values and the way that we will behave requires courage. And I think you have a lot of stories because you've had a lot of courage. You've stepped out into it.
Well, thank you. But I also think that all nurses have courage. I think courage...
well, it's there for us. I'm not sure if we all make the choice to...
It's there for us, to choose, The other thing I think about nursing stories is that if you know all the elements of a person, they won't tell you everything. And you won't be sitting down. It'll be while you're doing your practice.
Absolutely.
While you're doing your sponge, while you're actually doing your observations, whatever. It's important that we encourage them, the patients and their families, to tell them about us, about themselves, so that we can actually really, really tailor the care for them, that person-centred care, patient-centred care we talk about.
The community nurse in me will just get us away from the bedside, but the principle of it is exactly the same.
Yeah. And in any setting.
In any setting.
Yeah.
I think, though, because when people are receiving healthcare, wherever it is, there's a power imbalance, and I think that nurses have the responsibility and obligation to draw that out. I don't think it's easy for a person to tell us things about us, and we talked about this not very long ago. If we just asked one question, tell me what it is that today, in working with you, is the most important thing I need to know about you, like a simple question, whatever it would be, even that would just help that person to stop and to think.
Or tell me what's worrying you today.
Yeah.
Tell me what's the most important thing that we can do for you.
Yeah. But I do think that is the nurse's responsibility to do that. And so I salute you for saying that we all have courage. I think we all have the capacity or the capability for it. I'm not sure we all have the courage to step in and take that up.
Well, I'd certainly encourage all nurses
to
have that courage.
Yeah. Well, because I can remember myself as a beginning nurse, the confrontation of needing to speak up, to stand in the space for somebody. There were times that I wasn't my best self, and through reflection and different things, you can navigate through it. But I have a story about when I wasn't as courageous as I would like to have been. And it's a learning thing. And I think that just to come back to why you are sharing your stories, and I know from working with you that people's learning all the way through, never stopping learning is very, very dear to your heart. And I think that your stories, that resonates through your stories and your telling of stories, because you say somewhere that you encourage the reader to tell their stories, and you say for yourself that you still believe you've got stories within you that are not yet told.
Actually, I say this here. I say in this book I'll be sharing with you my story, in my student training, my clinical practice, and how I became an EDON, which is an executive director of nursing, and eventually I had the privilege of working as the chief nurse. So that in itself is a story. But I also endeavour to capture a snippet of the key nursing stories that I have within me to this day. And there's still so many more in me. And, look at all the nurses across the world, how many stories they've got in them to share. And this is what this is about. Our podcast is to use our book as a platform to actually encourage and inspire the nurses and midwives of the world, even though we're saying nursing, it's midwives as well, implied, that to share their stories.
When you were talking before about people who we might care for and with, I had the picture of that we are immersed in stories all the time, that a story is unfolding around us like every moment that we are providing care for and with people and their families. It's not linear. As you said before, it's not segmented. There's not a protected space for it. It's actually unfolding as we be and as we do the work of nursing. And I really I liked to see that picture, because a lot of times we can get caught up in the tasks of things, and we can lose sight of what actually matters. And I think that it comes through very strongly that reflective practice, on practice and in practice, is a really important component of being able to recognise the story, to have a raised awareness that a story is unfolding here. We are in a story, and the story of the person receiving care and your own story as a nurse is it's coming together. It's entwining.
See, I see the profession which I write about as the glue to the health system. Keeping it all together in the provision of constant care. I know we're talking bedside nursing,
sure,
but really within all specialties and all settings, we actually do provide that constant care.
Yes,
that glue must be strong, and the multifactorial components and the challenges of providing that safe care and quality care can sometimes put pressure on that glue. That's what I say about it's so important that when a patient or when a person and their family enters a health system, that they feel as though that they're safe, they feel as though that there's nothing, our role as nurses, providing that glue, is to ensure that they actually have that constant care, that constant empathy, that constant, compassion that we can give them as human beings.
Have you read all that you want to read out of there? I think you've flagged something else that you wanted to read, or
I flagged. I think the other thing, what I'd like to talk about in the nursing stories, is that by sharing nursing stories, either through having clinical supervision, as you said, or reflective practice, or professional development days, maybe sharing their nursing stories on professional development days, sharing stories at the end of a staff meeting, maybe. There's all settings.
Yeah.
The world's your oyster, actually, with this. Yeah. But you can actually bring out things like that intimate stuff you talked about before, the intuition of a nurse. Nurses actually have amazing intuition. And that intuition can always, you can always have that gut feeling if something's not right. I still know now in my life, in my personal life, if things aren't right. I still have that intuition. And it can prevent patients deteriorating. It can prevent situations. And, I think intuition is a key thing in nursing. What do you think?
I agree completely, and I remember learning the lesson of how to nurture it. Um, conversations that go, oh, I sort of think, I'm not really sure, I can't really name it, but I've just got this feeling. And being so fortunate, my first nurse unit manager to say, tell me more about that. Speak, tell me it. And, feeling a bit silly because, you can't name something. And we are in an industry that is dominant with language that shortcuts and reduces things. And for her to say to me, come on, what are you thinking? Just say whatever's coming to mind. And being able to just think aloud with her and eventually find a path to what it was that I was thinking was such a gift to me, and it helped me to learn a few things to develop my emotional language, so I could articulate better what I might have been feeling, to put things into sort of subjective sort of conversation as well as objective conversation. But the gift she gave me was not to turn that gut feeling down. Yeah. Had that been an encounter where somebody said, that's nonsense, they always do that, or had just brushed me aside, I'm eternally grateful that that was not the conversation that had, and that's a story in itself. That was a nurse unit manager willing to invest in me and willing to believe that I had something to say about the life and care of another human being. So it's pretty special.
I guess something just came to mind where I found that in my practice, ward rounds.
Yep.
That used to be, and rounding in any specialty, they have sort of rounding in specialties, any specialty. If the medical officer asks you as the nurse to give the patient's, story, it's so important that you actually advocate for that patient.
Yeah.
Because what you say can mean so many things. And also bringing the patient with you as you're speaking to the team who's at the ward round.
Yeah. The nothing about me without me.
Yeah.
I do remember nursing with a person who their birds were the only things in their life at that time that they loved and that loved them back. And I remember sharing that as part of the conversation, the clinical conversation. And in my mind, I'm thinking, well, that's love and that's companionship. And when we're separated from that, we feel anxious. We might worry about who's caring for them. And coming back to courage, you sometimes in the storytelling have to sort of endure some not quite rolling eyes, but there can be a discomfort and a tension there when you are advocating for somebody and what matters to them. Because, and I get there are many moments when we want short, sharp, we've got a life that must be saved immediately. Yeah. I get that. But I think that the narrative is incredibly important when we are talking about this person's life. I mean, it's their life. It's sacred. It's a big deal. And if that's the love and the worry that you have, I've always felt that it's very, very important to speak on behalf of and put that, because you can't separate it from the way that a person is feeling and experiencing the breakdown of their health.
But if you have that intimate knowledge of that patient, you're able to express that.
Yes. Through
listening to that patient, that person, and their family.
Yes, but I do think it takes an amount of courage for a nurse to say that this person is missing their birds, and I know I'm being frivolous with that, but essentially I think it takes a lot of courage, because you are the system is. There are drivers of busyness, of time, of all of these things. So, but yet that's a richness within a story, within that person's story, and for me, knowing that about that person is a story that I haven't forgotten.
But you've never forgotten
absolutely, and it was about 2000 in the year, what's that, 26 years ago.
It's amazing.
Yeah. It taught me about love. You can love other things. You can love birds in cages, which is pretty special. Yeah.
I also think that nursing stories can be a pathway to resilience. Because you're sharing. If you're sharing a story, a difficult maybe it might be a difficult story, a difficult situation you've been in as a nurse. You've had to use courage, you've had to really go out there. But if you share that with one of your colleagues as a story, that can help you become resilient, can help you realise that you're not alone as a nurse. For feeling alone sometimes can be pretty daunting. When you're working in these environments.
Going back to the situation we were talking about earlier about clinical supervision, and I can still feel as well as hear, and all of my senses, that session where a nurse shared something incredibly. It happened that we became very still because we knew that we were in the presence of somebody sharing something that really mattered. But a feeling that I had was, it's okay to feel like that. And from a resilience perspective, I think that gives you another coding to say, it's okay. They're sharing this, and I don't have to hide those feelings. I don't have to push that out of the way. I can share that. I can talk about that, and it does make you stronger, more resilient. Yeah,
it does.
Yeah, and the sense of collegiality
makes you. It helps with confidence.
Very much.
I found the first time that I was an advocate in many situations that it took courage. Yes, it took courage, but it improved my confidence. It really did.
So practice.
Yeah, exactly. But I think the other thing too is we talked about the sharing of wisdom. There's so much wisdom within our profession.
Yeah.
You think about it, the years of practice that people have, and by tapping into that wisdom through sharing a nursing story, I reckon it'd be amazing. I've done that.
Yeah.
And it's been an amazing experience. So that's why I'd really encourage all nurses to share their stories.
I'm not sure if you remember this, but when your book was launched, I had the opportunity to talk to a student of nursing, and I just said, why would you read this book? And the nurse said to me, because it would be incredible to read about this person, and I gave a little bit of background about you, would be incredible to read what they've done. How did they get where they got? And this person actually coined a phrase like, I wasn't school smart. I mean, I wasn't sure what the point of that was. I think it was putting themselves down a little bit, but saying that this would be so helpful to me. And I said, what in particular? And they said, well, I don't know what it is for a person to die. And I said, there are stories about that in here. She said, well, for me personally, that would be very important because it's something that I know I will confront. And interestingly, this week, the same student is on a nursing placement, called me to say, somebody died today. And I was with the registered nurse caring for this person and told a story about they went away, they cried. Is it okay to cry? I said, read page blah 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 of Cheryl's book. She talks about when she herself was in this situation. I talked to her yesterday. I feel so much better. I feel like just being able to talk, being encouraged to talk to my registered nurse about how I feel, but what was happening for that person. I asked some questions about that person, and it rounded them out. It brought them. They became a person to me. And I thought that was really a really beautiful story. And I know that is a story that person will never forget.
Yeah, absolutely. No, absolutely. Well, we do touch on that in one of our podcasts, don't we? In our future podcasts.
We do.
It's all been an amazing story, my journey. I think we're not touching on that in these podcasts, but having the privilege to be a leader of so many nurses and to, ensure that you're empowering them to be able to be the best they can. And to me as a leader, that's what I tried to do. Tried to instill them to be the best they can. Everyone's got untapped potential. And, so that's what I have written about some of that in my book.
Well, without giving anything away for future stories, I think it's time to wrap up.
Yeah.
So thank you, Cheryl. There's so much to think on and to reflect on between now and when we're going to come back together, when you're going to be sharing a story about, let me remember it, staying human, being and staying human. Thank you for being with us today. And until next time, this is Beth, and you've been listening to Nursing Stories from the Heart.
And this is Burnsy from Our Hearts to Yours. We encourage you to share this podcast with your colleagues and friends, and we hope you enjoy them.
Do you want to tell them about your book?
Yeah, I'll tell them about the book. If you are finding value in these stories, and if you want to explore the history of my story, you can find my book, Memoirs of a Matron, in a bookshop. Your support helps us continue sharing these stories. I didn't really write the book to sell books. I wrote the book to tell my story and to let you listen to them.
And it's a great tale.
Thank you.